Thank all of you for what you do, and I know that you're passionate about health care, as am I. We're all creatures of our environment and our upbringing. My mother was a registered nurse, an RN, working in an emergency room at a charity hospital, and she retired from that. In fact, I'm going to leave here in just a little bit and go have lunch with her. But she told me and my brothers and my sister every night how important it is that people have access to quality health care, especially the people who struggle the most in order to afford insurance or to access care. And those were the people that she took care of every day. And so I bring that mindset to the governor's office as well. So I actually have a history related to Medicaid expansion that predates the election and predates the campaign. For 3 years, I filed legislation in the House of Representatives here in Baton Rouge to try to force the Medicaid expansion because I believed it was the right thing to do. And I thought the worst thing we could do is wait, because the longer we wait, the more money we leave on the table, the longer we go without people having access to health care, the longer we put pressure on our budgets, the longer we put pressure on our hospitals and other providers, and the longer we wait before we can have better health outcomes for our people. And for a state that has more than its fair share of poverty, more than its fair share of people without insurance, has the least healthy population in the country, or at least we're right up there at the top of that list, and have some of the worst health outcomes, it just didn't make sense to me to keep waiting. And I understood that the Governor General's opposition was related to whatever it was related to. I just didn't think it was in our best interest. So I filed that legislation for 3 years, and it was very distressing, but I didn't find a receptive audience in the legislature. And quite often people would vote against the bill, but in private conversations they would tell me, oh yeah, we know we're going to have to do it someday, but we're just not going to do it today. And I kept asking them, I'm like, okay, so when you want to make a decision to buy a stock and you know that it's cheap today and it's going to be more expensive tomorrow, you're going to wait till tomorrow to buy it? That's not what you do. But ultimately, we weren't able to succeed in the legislature over the past few years, and that's why I will tell you it gave me great satisfaction knowing that I was doing what was right for the people of Louisiana. When one day after I was inaugurated, on January the 12th, I signed an executive order expanding the Medicaid program to 138% of the federal poverty level here in Louisiana. We are on track. It is difficult, as you know, but we expect that we'll have more than 300,000 people enrolled in the Medicaid expansion. We will actually start issuing cards 1st of June. And the expansion itself, in terms of accessing care, starts on July 1st, the first day of next year. And so I want to talk to you for a few minutes about ways that I expect Medicaid expansion to benefit Louisiana. It's good for the people. I believe it's good for doctors and hospitals and other providers. It's good for our budget as well. How is it going to benefit the people of Louisiana? Well, when people have insurance, we all know that they're more likely to get routine preventative care and have a regular primary care doctor. That also means that they will stop relying upon emergency rooms to receive routine care. And we know that emergency room care is great for emergencies, but it's not particularly good at managing people's health. And also it is the most expensive way to deliver that health care. So we know that this is a step in the right direction. It allows individuals to get needed medications and to better control chronic health conditions such as diabetes and others. With insurance, women are more likely to get mammograms and other cancer screenings. And access to health care not only results in better individual health outcomes, it also helps to grow a productive workforce. And what we know around Medicaid expansion, here in Louisiana, 70% of the people who are going to get coverage through expansion, they are working people. You know, these are the working poor. They're just caught in a trap. They make too much to qualify for Medicaid today, but not enough to receive help to go out and get insurance on their own, or even through the exchange. So they've been caught in the gap, and that's who we're trying to bring into the fold. You know, for example, of the folks who work, we have nearly 30,000 employees in the restaurant industry in Louisiana who are eligible for expansion coverage, and 15,000 construction workers who don't have health insurance but will qualify under the expansion. So this is just the right thing to do for our people. And now I don't want to just give them a card for the sake of giving them a card. I don't even want to give them a card for the sake of saving the state money. I don't want to give them a card just so that those hospitals and providers get more reimbursement. All of those things are very, very important. I want to give people a card so they have access to better health. We had better deliver better health outcomes because that's why we provide it. And that is challenging, especially when you have a group of people who have been underserved and they have pent-up demand for a lot of health services in order to achieve a better health outcome. But we know that that's ultimately why we are doing this. And so it is the right thing to do for the people of Louisiana. You know, for me, and I will tell you, we just came through Easter Sunday. I believe it's the right thing to do for the least among us as well. I'm talking about Matthew 25. I'm talking about Luke chapter 10. What was it that Jesus modeled to us himself about what it means to be neighbor? We know it wasn't the priest or the Levite on the road between Jericho and Jerusalem who was neighbor to the robber's victim left for dead on the road. It was the Samaritan who stopped and rendered aid, poured oil and wine into the wounds, bandaged him up, put him on a beast, took him to an innkeeper, and paid the innkeeper money and said, "Take care of this man, and if it costs more than this, I will settle up with you on my return." Now, the example given to us by Jesus Christ himself as to what it means to be neighbor is to provide health care to a stranger on one's own dime. In Louisiana, we were paying the dime and refusing the care. Now, it would be arguable to me that maybe we ought not do the expansion if we could somehow avoid the cost associated with it. But if you're paying and refusing the care, well, let me tell you, that's wrong on every level that I can think about as being wrong. And as a Catholic Christian, it offends me as well. So I know that we are on the right side of that issue today. And that is why we have to work together to make sure that we are neighbors to one another here in Louisiana. Because what happened 2,000 years ago on the road between Jericho and Jerusalem is interesting. But it isn't as important as what's happened on the road between Bogalusa and Bossier City, between Amite and Abbeville. You just pick the two places in Amite. We got people lining the road in Louisiana today, and that's what we better be concerned about. Now, it's also good for our doctors and our hospitals and our other providers by ensuring that more reimbursement dollars get to them and they remain viable. They can keep their doors open. They can hire people. They can provide these services. And you know, right now, even as I'm talking to you, we have folks from the Department of Health and Hospitals giving testimony to the a subcommittee on the Appropriations Committee, talking about the challenges we have around our $750 million shortfall. And right now, with that level of cuts, we are going to struggle to keep our safety net hospital system alive, the one that my mother worked in for 30 years. And in fact, right now, we estimate we have the money to keep 2 hospitals open, and we're going to prioritize the hospitals that are important for graduate medical education, those being in Shreveport and New Orleans. And so we have to do what we can to keep providers in the business of providing health care, knowing the challenges we're going to have around the safety net hospitals. Now, in truth, when we have the Medicaid expansion in place, and we have more than 300,000 people who are uninsured today insured, our reliance on the safety net hospitals ought to be decreased. But we need time to transition into that and do it in a way that serves the people of Louisiana. These budget constraints are not going to allow that if we don't raise some more revenue and keep those hospitals open and allow for an orderly transition to a new healthcare delivery model in Louisiana. So I am not satisfied with that testimony that's being given right now. I'm not satisfied with that plan. We're going to do everything we can to shore up these safety net hospitals and keep them operating. But with a $750 million shortfall, we simply cannot. So we have a lot of work to do, but this Medicaid expansion is more important today because of that shortfall and because of the challenges around our safety net hospital system than it would have been otherwise. I also want you to know that other southern states, such as Alabama and Georgia, have seen rural hospitals close because of their decisions not to expand Medicaid. And if you ever get a chance to look at it, and I'm sorry I didn't bring it to show it to you today, we have a map of the United States that shows rural hospital closures. And if you overlay that map of the United States with a map of the states that chose not to expand Medicaid, there is almost a direct correlation. Don't think that that wouldn't happen in Louisiana had we not expanded Medicaid, because it would. And in fact, we have a hospital, it's not a rural hospital, right here in Baton Rouge. Mid-City campus of Baton Rouge General closed its emergency room because too many people were visiting that emergency room without reimbursement dollars going to the hospital. And so it closed that emergency room. So now we have a situation in the capital city of Louisiana without a hospital to serve North Baton Rouge and downtown, because we've closed 2 hospitals there over the last few years. Well, we closed the Earl K. Long Hospital and then the emergency room at Baton Rouge General. And I'm working very hard to get an emergency room back open in North Baton Rouge so that we can better serve those people. But that would play out over and over across our state without the Medicaid expansion, especially in light of our current fiscal challenges. So understand that this is very important for our providers as well as our people. It's also good for stabilizing the budget. We're $750 million short. Now, that's the good news, I guess, because until a couple of months ago, we were $2 billion short for next year. Well, we had a special session. We raised some revenue. We didn't raise enough. We didn't quite get the job done. And so we're putting together a budget right now that has $750 million less in state general fund than we need just to provide the same services next year that we're providing this year. Not including inflation, not including more dollars for K through 12 education or merit raises for our employees. In the strictest sense of the word, a continuation budget only. Now, what we know is that in the first full year, next year, Medicaid expansion is going to save the state more than $100 million. So that $750 million problem without expansion becomes a $850 million problem. So we know that this is important for our state. It's estimated that by expanding coverage and taking advantage of the fact that the federal government will now pay for a majority of the cost of care through a much better match, we can reduce state general fund expenditures today and in the future. So think about the situation today. We're paying 38 cents on the dollar for health care in Louisiana, whether it's through the DISH program or through the Medicaid program. For those 300,000 plus people, we're never going to pay more than 10 cents on the dollar. Critically important that we make that move, especially when you know that DISH reductions are looming starting next year, and by 2020, those DISH reductions could hit us by as much as 75%. So we're avoiding, we're saving as much money as we can today, and we're avoiding those cost increases down the road. Incredibly important for our future. Especially when you think that for every dollar of DISH that we lose, if we don't expand Medicaid, we have to replace that with 100 cents on the dollar state general fund. Not just 38 cents, 100 cents. So it's the right thing to do. And I'm not here telling you it's the right thing to do as a way of justifying it or saying we ought to do it. I'm telling you why I did it and why we're going to benefit from it starting July 1st. Because I still have some folks in the legislature who don't seem to understand the importance of this for our state. They don't seem to understand how important it is for our budget, for our providers, or for our people. And now the good news is they're in a minority, but they have to stay in a minority in order for us to be successful. And that's where you can come in. You can communicate with your legislators, both in the House and the Senate, and make sure they have the benefit of your experience in this area, of your judgment as to whether Medicaid expansion makes sense. But I know that we're on track, and the folks in the legislature are much more receptive today than they were last year or the year before. Thanks in large part to your hard work in this area. So we're going to bring our federal tax dollars back to Louisiana to put them to use for our people, as opposed to those dollars going to Washington and then being allocated out across the 30 other states plus D.C. that have expanded their Medicaid programs. That just makes sense to me. Under the current circumstances, it makes more sense than ever. So it's incredibly important that we succeed and that we deliver better health as a result, and that we continue to reform our Medicaid program and make it work better for the people of Louisiana. We're going to do all of those things. I need your help to make sure that we are successful. So with the support of people all across the state and with the healthcare community, with managed care organizations supporting, with the faith community across Louisiana in support, we are well on the road now to expanding the Medicaid program in Louisiana, improving people's health, and improving our state as a whole. As members of the healthcare community, I know that you look forward to working with me for years to come to make sure that we are successful and we better serve the people of Louisiana. Let's together be better neighbors to the folks here in Louisiana with respect to healthcare. Your input and support are important in my administration's desire to build a better future for our state and for our children. And together, we are going to do that, even in this very challenging time. Because in times of crisis, it's actually more important that you get it right. I guess it's relatively easy to govern when the treasury's full and everybody's happy and you're just trying to figure out how you spend those extra dollars that you've accumulated. I dream about that at night. But in the meantime, and by the way, we're going to get there again. We're going to get there by working together. We're going to put this state on a path to prosperity, but without some shared sacrifice in the short term, that will not be possible. So I am calling for shared sacrifice as we get on the road to shared prosperity. But I need you to partner with me to make sure that we're successful, and make sure that while we go through this very turbulent time of all these fiscal constraints, that we do our very best to serve the least among us. So I want to thank you for the opportunity to be here with you today. Thank you for what you do every day. And if I can be of service to you, please don't hesitate to call on me in my administration. We look forward to working with you for years to come for the benefit of the people of Louisiana. And I know there's more to health care in Louisiana than just the Medicaid expansion. But right now, it is the single biggest initiative that we have underway. I know it's something that's very important to you. And so I look forward to working with you on that, but on many issues going forward, especially around mental health and other. By the way, I didn't cover this, but you know mental health has been covered since December 1st of last year in the Bayou Health Program. So by expanding the Medicaid program, we're also going to make mental health care available to that expansion population as well, in a way that is not available for them today. That is a big step forward in the state of Louisiana as well. And I've just looked at my watch. I'm supposed to take it off and put it down. I exceeded the time that Alma gave me. I apologize for that very much. Yeah. But I want to thank you all again, and please keep doing the good work that you're doing. God bless you.